Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the School of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I welcome Wayne Shelton. You are the Director of Campus Sustainability and Environmental Safety. Thanks for coming in.
And thank you for inviting me. Glad to be here.
Now that's quite a long title, but it's an important one, especially now that we're dealing with COVID-19, because you are overseeing some of the important protocols and such that need to be put into place now that we're anticipating some students coming back to campus this fall in various types of educational formats, but nonetheless, there's many protocols that are going to be put into place. So tell us some about the various preparations that SU is taking to bring students, faculty, staff back to campus.
Well, it has been quite a process. It's involved up to, I think, 13 different groups, different committees in this process, making the decisions and making things happen. One of the things that we always want to share with people is there's still a process where people can work from home, and if they can complete their job, fulfill their duties at home, then by all means we're going to continue to support that. There is even, of course, opportunities for students to take classes fully online, so they won't even necessarily have to live here on campus or remain near campus in order to take their class process. So having them at a distance is one of the ways that we've come up with handling this process. The other, I think one of the other types of processes that we put in place is the development of a screening app. So we are creating an electronic phone-based app and also computer-based. It can be handled by online as well. But individuals will be able to look at their symptoms, report their interest in coming to the campus on a particular day, or indicate that they're not planning on coming in, review their temperature and other symptoms that relate to that app, and then having successfully passed it, they will get a screen that will indicate that they've been accepted to come in. So if need be, faculty in classrooms can ask that students hold up that screen, especially if they're in a situation where it's a lab or they're modestly close. That can be an option for faculty to do that. The other process is for visitors. We're able to have them go online and fill out an app or show at various locations around the campus and get screened in person, and then they will get a sticker that they can put on their person, and then we can tell from the process of looking at individuals on campus that wear their badges, their ID cards, we would know that they've been through some sort of screening process, they're a campus employee or a student. Or absent that, we know that individuals with the green sticker that they'll wear have also been through that same screening process. So screening, we believe, is it's not only required by all University System of Maryland institutions, so we're consistent with their requirements, but also it is legislatively required for walking into a state building at this point in time. So we're meeting that. We're also doing our best effort to make sure people are thinking about what their health symptoms are and then reporting if necessary. So hopefully everyone will have understood the message. If I can't pass the screening process, I need to stay home, I need to seek medical attention or whatever the proper next steps are.
And I know at the end of the day, though, we are still trying to limit visitors, to some degree, so we don't have so many people on campus, especially, there are some certain situations where students, we expect them to be on campus for certain things like labs and clinicals and things like that. And then there are some face-to-face classrooms, but I know you want to talk about how classroom density has been modified in terms of spacing so that we don't have too many students in a particular size classroom.
True. So what we have done is look at classrooms in particular, but also labs, studios, other shared spaces where students or others are going to gather, and then we've implemented a 6-foot minimum distancing protocol. And that cuts down significantly on the total number of people who can be within the room. From past numbers, we're experiencing a 50% reduction to maybe a 75% reduction in something like a auditorium where the seating is fixed. So once you move everything around, so you've got that 6-foot distance, you find that you can get very few people in that kind of setting. So, so we've made those modifications and drawings. We're going to post those on the outside of the doors, and with those reductions, we're going to schedule classes accordingly. And seems like the class schedule is looking at a variety of approaches, but in approaches where they are using the classroom, they're going to be alternating so that they can accommodate a larger number of students. If there's, for example, if the room has been reduced to 25 and their limit is 50, they'll alternate days where they're on campus, and then the other students will participate in some sort of online version of that session.
I know it's been quite complicated planning all this.
Yes, it's definitely beyond my usual experience, and from a planning standpoint, I've been here long enough to have seen a variety of things happen. I came into this position when 9/11 happened, and that same year we were faced with some scares for anthrax in nearby post office. So we were looking at bioterrorism, we were looking at terrorism. This is even much more different, much more difficult as a topic and a situation.
It is. It's a whole new ball game.
It's whole new.
That's why we're doing these shows, to educate people.
Yep. Okay.
I know you also wanted to talk about signage. That signage is going to be a big part of the plan.
Yes. So we've worked with our public relations. We've created some SU-centric type signage. So it features SAMI. It features consistent message and color. It covers a wide range of areas. So signage is going to be placed beginning at entry doors. So at the entrance, we're reminded that we should have screened for that day before we enter that building. It'll also say wear your mask. It'll say wash your hands for 20 seconds. It'll say be sure and socially distance. Keep your 6 feet from others. So it has the basic reminders, and as we enter the building, there'll be additional signage in the hallway which will support good habits. For example, if there's a hand sanitizer station in that hallway, we will point them to that with signage. The sanitizer will remind people that washing our hands is really the best method for hand hygiene, but followed by that, we use hand sanitizer if our hands are literally not dirty, and then it's not convenient to get to water, running water and soap. So that kind of messaging will be in the hallway. We will be putting signage up, and we will be taking water drinking fountains offline. We will still allow the water bottle filling stations, which are much more sanitary and hands-free as an operation. But we're trying to keep people's face away from those. We'll be doing more signage in the bathroom to remind about not only washing your hands, but also as you leave the bathroom to use your paper towel that you dried your hands with to open the door handle in cases where the door swings in. There'll be other signage around that'll kind of support the directionality in the space. So if there's a suite that you're visiting that has 2 entries, one might be the entry side, and then the other would be the exit side with arrows on the floor to indicate how you walk through. The other thing, and the exit door might actually be locked just for convenience, so that you don't have to worry about having that open as well and people just ignoring it. There'll be wait here signs on the floor. I mean, the list of signs goes on and on. And one of the nice things that the Public Relations Department has done, not only have they done a great job of putting these together, but they've also made this available to the public. So individuals in our community can borrow, use, with permission, in any way they'd like, the signage that we've created, just to remind people of the importance. So those will, I think, be some critical signs that'll be up. And then somewhere along the line, we want to have a sign up that shows variations of distancing, two individuals close together with no masks, that is the highest risk situation, followed by incrementally to being at home by yourself, speaking with somebody or communicating with somebody else at a distance is the lowest risk. So everything in between is also illustrated and the levels of risks are described.
I know I was in a campus building today and used the restroom, and I noticed how they've covered up every other sink with a sign to say, you know, placed here for social distancing purposes.
Yes.
So it looks like we're getting a lot of things underway already.
We are, yes.
What about common areas? I know we're working towards removing those because that allows for more intermingling and so forth.
True. So because of the chance that individuals will not necessarily sit at the proper distance, 6 feet apart or greater, and the likelihood that chairs can be easily moved and grouped, many of these areas are going to be designated as offline. In some cases, the chairs will be completely removed. In most cases, they will be marked with some kind of tape or covering that will say, please do not sit here. So the downside of this is, you know, I always think of the university as a very social environment. Students, you know, come here for the experience. They want to experience other students. They want to experience the campus life. And unfortunately, it's all going to have to be at a distance in order to keep the spread of this at bay, keep it under control. So that's a very unfortunate side effect, but it's one of the realities that we'll deal with in order to keep everyone healthy.
Yeah, I agree, and hopefully just maybe one more semester or so, because we're all have our fingers crossed for a vaccine. But the time is now to implement many of these policies and procedures. I know you wanted to talk a little bit about the filtration system, changes been made to that, and ventilation systems and so forth.
Yes, so we have looked at building ventilation systems. Because the virus transmits by very small particles which will float in the air, there is a question as to what filtration level the building systems currently offer. So we have a wide range of buildings, older and newer. There are quite a few, fortunately, that are able to filter at this higher rate, which is called MERV 13, MERV 13. And that rate is one of the ones recommended by the engineers and the professionals that deal with ventilation in general. So at that rate, it's expected that many of the viruses will be trapped, probably most. So in buildings where we can just simply change out the filters or they're already existing in that way, then we're in good shape. In buildings where there are older systems or smaller systems and they won't handle the additional back pressure from those filters, we are going through and we're going to place in them some portable air filtration devices. Many of us would call them they're HEPA filters, high efficiency particulate air. So those devices are going to be placed around in both classrooms, shared spaces, offices that have multiple individuals in them in order to filter in the background. But just the same, we're all, as members of this campus community, we're all going to be expected to wear our mask whenever we step up from our desk and leave our office, and we're walking down the hall, we're walking anywhere in the building, we're meeting with anyone else, or if someone steps into my office, I put my mask on. So all that time up until lunch, and then at lunch we're keeping our distance in order to do that. So it's a very new world, but hopefully we can get through this semester and get, as you say, to the time when we have got a vaccine.
To a better place.
Better
yeah,
place.
Herd immunity and so forth.
We all want to get to normal. It might be a new normal, but we all want to get more normal.
I know. I also wanted to ask you about the use of plexiglass. It's everywhere now. So where is it on campus, or how is it being used?
So we have ordered, bulk ordered plexiglass, and we've looked at each building not only from the standpoint of this discussion about spacing people and access, but we've looked at locations where there are service areas. So it might be an administrative desk where someone can walk up, interact with the administrator and then administrative assistant, and then walk away. So we definitely want to have a barrier there. So those are all going to be provided. That equipment has been planned for any of those type areas, service areas where you come up and you either get equipment or some sort of transaction happens where individuals are typically very close to you, coming and going. So those will be arranged. And areas where there are multiple users and there's no barrier between those users and you can't necessarily get the 6 feet, we're going to create a barrier with the plexiglass. So if you go to the bookstore right now, they are fully outfitted. If you go to the library right now, they are outfitted. So all of those locations currently have those in place because they're expected to be some of the earliest operations that are going to be open. But very soon they'll be issued around the balance of campus.
A lot more to focus on yet with time coming up that students will be here. And I know one important topic we want to talk about is the wearing of masks and face coverings in general. This has been an issue across the country, but we really have to emphasize how important it is to wear a mask. And I know one thing I wanted to mention was a study I saw the other day that you definitely have to wear the mask over the nose because that is where you shed the most virus compared to the mouth. So you see a lot of people walk with it just under their nose. It has to be over the nose. And of course, other face coverings are going to be appropriate as well, the gaiters, shields, and so forth. So talk a little bit about the mask as far as are they going to be available on campus and so forth.
So what the arrangements that we have made, we have ordered 2 of the reusable, washable masks per faculty member, staff, and then we're also going to be providing 50 of the disposable type masks to each department center. So if there is some reason that a staff member has a soiled mask or can't use their mask for the balance of the day, they can switch out and use a disposable mask for that day. So they will continue to be provided to those departments throughout the semester. So fortunately, there's not an issue with availability. In addition, there'll be access to students who don't have masks, where they'll be issued masks for the long term, and then disposable masks will be available, for example, at the student union or other locations, possibly the library, but that's another alternate location. So on the COVID-19 webpage, there will be information about where and how they can get these masks should they need them for whatever reason. I guess the main thing that we are stressing is that please wear a face covering. It can be a wide range of things, and yes, they do differ in their filtering ability, but the fact that they can capture some of these moisture particles coming from someone's nose in particular is very beneficial. So it's important that we have that capability.
I know we're dealing with a younger population, obviously, and oftentimes they don't even get symptoms. They don't know they have it, and they can be shedding virus during that time to more vulnerable family members, faculty, staff, that are up in age or have some of the comorbidities that are problematic, like hypertension, diabetes, obesity. So it really is important for everyone, but especially young people who may feel like, well, I feel great, I don't have it. They could possibly have it, and we need to protect, with respect to other people, protect their health. So again, just really important to follow that mask policy.
It is. Indoors
at all times, and then outdoors when physical distancing isn't possible.
Correct.
I guess it's better just to wear it.
It is, and I would say one of the worst things I can think of is if I were to not have symptoms, be asymptomatic, and then have that transfer to someone, family member, a friend. I would feel very bad about not following the protocol if something like that was happening. So we each have a responsibility to take care of each other. So.
Exactly. And masks are starting to turn into a fashion accessory.
They are. I can tell you, I'm there doing screening of our staff from 6:30 until 8:30 in the mornings. So I have seen all kinds of interesting. It is quite the fashion statement anymore.
Do we have one with Sammy yet?
We do
I'm
have
waiting
one with
for
Sammy.
that.
I have one with Sammy, actually. Yes, I do. The president's office in particular has them as well.
Sure.
Yes.
I'd be in on that.
Okay.
So yes, you mentioned the importance of the shared responsibility, and I think that's a really important point. And another thing I read, a recent study, is that if you've been infected, whether you have symptoms or not, you can even have after effects from this. We just still don't know a lot about COVID-19 yet. We're learning more each and every day. And I believe I saw a statistic where up to 35% of people who are infected will continue to have symptoms that persist for several weeks, and that can be fatigue, shortness of breath, that kind of thing. So it's not something that's innocuous. It's not something we should say, oh, no big deal if I get it.
Right.
It's best just not to get it and implement all these safety precautions, including the washing hands, PPE, social distancing. Did you want to talk to us a little bit about cleaning products and things that you're doing for sanitizing?
I do. So among the other processes or supplies that we have planned to issue out to the campus includes I would call it a kit of cleaning supplies. So we have a disinfectant that is effective and approved for, it's on the EPA N list, so it is effective in killing this virus. It's not caustic, it smells really nice actually, it's not going to hurt your skin, so we can spray it on all the hard surfaces and even soft surfaces that'll accept it. The only thing we probably shouldn't do is put that particular spray onto electronics. So we have an aerosol spray in addition that we're providing to all departmental areas. Classrooms will also get a batch of supplies, but the other thing we're going to do is provide some wipes, which will be able to be used on keyboards. So we'll have a range of things that are effective for that. And then hand sanitizer for some of these shared areas. So in offices, if there is a front desk, if there is a copier room, if there's a break area, we'll put the hand sanitizer there for those groups. So those are the basic components, and paper towels to try to take care of that. So those are the shared areas for non-classroom type situations. So for classrooms, the current plan is to get plastic buckets. We will put the same spray chemical in that bucket with wipes that will be pulled through there, just like a large Clorox or, I guess the other major manufacturers that would have those pull-out wipes. And those will be used on any surface. They can be used on electronics, on desks, any place that's needed. So those are supplies that are going out to our faculty and staff. For everyone, we're also giving out a kit. We're specifying or speccing those kits right now. They will have a small hand sanitizer. They will have one of those little, they're calling them keys, but they're the device that you can push buttons with and open doors. So that'll be in that kit. We will also include a lanyard so that everyone can display their ID. And as you know, we're moving more and more to an ID culture, mainly so that we can again, verify that people have been through a screening process or self-reporting. So the lanyard will be in there, and then there's one more thing I'm forgetting. It is one of the other key items that everyone seems to be it's probably a small amount of masks. Okay. I believe that's what it is.
Well, it sounds, again, shared responsibility. And I know I've learned that when I teach a class, when I do a face-to-face, I have to clean my area when I'm done, and then students are responsible for cleaning their desk and area, once they leave, so it's ready for the next person,
right,
type of thing. So many protocols in place. Did you want to talk a little bit about contact tracing? That falls under your purview.
It does. So Brian Waller, who works for me, has become the liaison for this for the employee side of contact tracing. So students are also going to have contact tracing as part of their process should the circumstance arise that we need that. So the employee side of things, essentially we have 10 or 11 volunteer employees who have gone through training for contact tracing. And in the event that someone self-identifies that I have the symptoms and they get tested, and we have to go back and figure out who they interacted with in order to keep the population safe to try to deal with that, we will go through and do some of that contact tracing ourselves. Now, I want to be sure that it's clear that this is not in place of the health department. This is hand in hand with the health department. So our focus is going to be on our employees, our staff, and whom they might have interacted with, so that we can get them to follow the next step protocol, whatever that might be. It might be to isolate, it might be to test, it might be both. So that's going to be taken care of by internally in order to expedite things. But there still is the whole health department process that we will fall under, and we will be subordinate to in the sense that they have the legal authority and the legal obligation to do that for the public. And then for the students, everything falls under the student health, as you might expect. So they will do all the contact tracing. They will have advanced nursing students volunteering to do some of the contact tracing as part of their clinical experience, so kudos to them. So they will be contacting those individuals and trying to follow that process.
Well, again, it sounds like cooperation is key with contact tracing so that we can identify who may have been exposed and so forth. So let's talk a little bit about what happens if there is a positive case. Of course, we already talked about contact tracing, but what about cleaning and isolation or quarantine? Okay,
so we have developed a series of protocol for students, in particular students living on campus and off campus, for a protocol for them to isolate. So we have plans, facilities, we have the process all worked out that we can put them into a location where they can be away from other students and until they get cleared medically for the next step. In most cases, students who test positive are going to be sent home where being sent home is possible. Where it's not possible, and certainly there will be some groups of students in that category, we are able to house them by themselves in appropriate housing for that particular process. So that's taken care of. The other piece of this is decontamination. So we have contracts with outside contractors who are capable to come in and disinfect an area where it's been documented that we have a positive case. So they will come in, disinfect, and it's done quickly, it's done same day, and within an hour or two, it's fully disinfected. So, and that's just drying time. It's the kill time for any of these chemicals is typically 10 minutes or less. So that's all been arranged and is in a queue.
It sounds like you're really ready, although we do know that COVID doesn't transfer as readily on surfaces. It's much more of a problem with the air exchange, and especially indoors, which is why it's so important to wear a mask. And everyone on campus is going to be expected to wear a mask, correct? There's no contraindication for not wearing some kind of face covering.
Correct.
And I also believe you have some procedures in place for non-compliance. Hopefully we won't have that problem, but...
Hopefully we don't have that problem. There is a website, a web connection where people can report cases with non-compliance. So we hope that's small. We hope that's not frequently needed. But those cases will be reviewed, and then whoever the authority over that individual or those individuals will be notified, to whether that's students, whether that's staff, faculty. So we'll work through those processes. So fingers crossed we don't have to really go there, but
hopefully people just respond to a polite reminder. I know sometimes I just forget to put it on. I just,
I stop a lot of times getting up out of my office because it's still new.
Exactly. Yeah. And what about trainings? I know you have plenty of trainings planned.
We are working on trainings right now, hammering out some of the details. We're going to cover the basics of COVID. We're going to cover disinfection, how to clean your own area, how to clean the areas that you're supervising. We're going to talk about best practices from a wide range of things, how to use your mask, how to store your mask, and the list goes on. So that's going to be up on the website. Likely it's going to be hosted on the informed pages of the COVID link on the homepage. So informed staff, informed faculty, informed students. So we want to make it very interesting, a lot of variety, short. That's the goal.
Exactly, but get the points across.
But get all the points across.
So in summary, it sounds like we all need to work together to get through this, and what are some key points you want to conclude the show on?
I would just like to encourage everyone to join in the process, to support the process. So for everyone's health and well-being, wear your mask, do your hand hygiene, socially distance wherever it's possible. Where it's not possible, wear your mask. Just some basic things such as that are going to go a long way to making everyone stay healthy and making this an enjoyable semester.
Let's hope all those things pan out. Because
Yes.
I know there's many people that are looking forward to getting back to some degree of normalcy. We're far from it, but at least get back on campus with some students that are ready to be engaged in learning, yet stay safe.
Yes.
Thank you so much, Wayne, for coming on today to talk about all these very important preparations and procedures.
Thanks for having me. Appreciate it.
And thank you for joining us for this edition of Focus on Health here on PAC 14.